Good afternoon and welcome to Talk, the show dedicated to helping home health and hospice providers run compliant and successful agencies. Talk aims to bring you closer to reliable experts in home health and hospice and to share the latest news and information from the industry and from the Association of Home Care Coding and Compliance. I'm Jan Milliman, Director for and I'm happy to be hosting today's program. And today we're talking about the Hospice Hope Instrument. And now I'd like to introduce our industry guests for this episode. We have Claudia Baker, RN, MHA, HCS-D, HCS-O, OC Board Chair, and Senior Manager with SimiTree on the call today. Claudia has 35 years of healthcare experience in the areas of compliance integrity, quality improvement, and managing regional and corporate operations. And we also have Elise Christensen, RN, HCS-D, COS-C, OC Board member and inpatient coder with Hartford Healthcare on the call today. Elise has been an RN for over 34 years and previously served as leader of the coding and OASIS review team for a large hospital-based home health and hospice agency. Thanks so much for joining us today, Claudia and Elise.
Thank you.
Yeah, thanks, Jan.
Sure. And let's go ahead and get the discussion started. Listeners, if you have any question for our panelists today, please go ahead and ask them in the chat pane, and we'll try to get to as many of those as we can. Claudia and Elise, I'm going to turn things over to you, and I'll advance the slides as we go.
Okay, thank you. Okay, so we are embarking on the HOPE instrument, as they're calling it, but a lot of us are calling it the tool or the assessment or the different things, but they are officially calling it an instrument. But the HOPE stands for Hospice Outcomes and Patient Evaluation, which is at least one letter and an acronym shorter than the HEART tool was that we had to begin with. So that's the upside. The HOPE tool is actually expected to provide hospices with information to help them identify opportunities to adjust their practices and hopefully improve patient and agency level decisions about the care they provide. So it really is intended to help with our outcomes and improve the way we're taking care of patients. So this HOPE data collection tool begins next year on October 1st of 2025, and that will be at that time for all newly admitted and existing hospice patients. Hospices will be required to submit up to 4 records for each patient admission, and that would include a minimum of the HOPE admission record, the HOPE discharge record, and then up to 2 HOPE update visits, which is another new acronym for us, HUVs, at each specified time frames. So as of October 1st of next year, then they will recommend that we submit as you see listed here. And then they've also given us deadlines on the time frame for which you'd have to have each one of those in. So from the time you complete that admission record or admission assessment, you have to enter it in, get it done, and submitted and accepted by them no later than 14 days later. The same with the HUVs or the update visits, no later than 14 days from the date that that assessment's completed. And then the HOPE discharge record would be no later than 7 days from the date of that discharge. Okay. So just to give you a feel of this HOPE tool, so it does contain a lot of different sections, and we've got one slide in here on the difference between the HOPE and the HIS tool, because there's a lot of difference between the two. So this the HOPE instrument items include sections with multiple questions each that include your demographics for the patient, screening tools, different items listed in there, all of which come together to help inform that comprehensive assessment for all hospice patients. So I just took the table of the contents out just to give you a flavor here, because this certainly is just an introduction to this HOPE tool, and to kind of give you a little bit of insight to it, and then help you understand that we really need to, as an industry, start preparing for all of this coming. So that Section A has a lot of the administrative information in it that you would expect. Section F would be preferences. We're used to doing diagnoses and some of the health conditions, but there's a whole new section in there on the skin conditions, which we would have never, we've always documented on the patient's skin, but not in a formalized way like this HOPE tool is going to ask us to do. One whole section on medications, and then the last are different sections on record administration. Okay, so to the next slide. This is just one example. So this one actually falls in the J section, and this is a symptom impact, a term you're going to hear a lot about going forward. So before this item, you would have an item that says, does the patient have any symptoms that are impacting or affecting the patient's assessment, anything that's going on with them? Are they having pain or shortness of breath or anxiety, nausea, vomiting, diarrhea, constipation, or agitation? And what we would do then is code that, and if you can see, it's kind of in small writing, I know there, from a 0, 1, 2, or 3, or a 9 if it's just not applicable in the case where the patient might not be experiencing any of those symptoms. So what we would do is enter the code on this tool, hopefully will be in all of your EMRs and ready for you to document in at this point. But you would document that code of whether or not the patient's having no pain, for example, at this point, or would the patient's pain be a number 1? Would it be slight? Would it be a number 2, moderate, or 3, severe? Or again, you would put a 9 in each one of these boxes if the patient isn't having any of these things, okay? So there will be lots of detailed instructions that come out, or that are out in the HOPE guidance manual, that explains to you how to use each one of these things. So the first question is the one you don't see on the screen, but before this it says, does the patient have any of these things? And then in this question, we would document how, if the patient's having any of them, and then to what severity, right? To what level is the patient having them? So the first question, again, before this one, is a screening one, and then you answer the question here based on whether or not they're having any significant or any issues with each of these items. Now, if somebody has a 2 or a 3 in any of these boxes, meaning that they are experiencing some of these symptoms with an impact of either moderate or severe, then the hospice clinician is going to have to go out and provide a follow-up visit to reevaluate that symptom within 2 calendar days from the day of that symptom impact screening once it's done. So from there, then there would be another question, and then we, in this setting, we're not giving you all of those examples. I'm just trying to give you a flavor of how it works. And we would need to go do that symptom follow-up visit, which again is another new acronym, SFV, that then would need to be completed to identify that symptom follow-up had happened, or if it didn't happen for whatever reason, you couldn't get out there in the next 2 days, or maybe something else happened with the patient, or the patient passed or something like that, you would have to document the reason why that symptom follow-up visit wasn't done. So this is one big new area, but I think it illustrates for you how different this tool is from the HIS tool that we're doing now. Next slide, Jan. Okay, so again, there's a big difference. So I don't want to scare everybody, but I want you to be very aware and alert to the fact that while the HIS tool, we collected admission and discharge, and there are a lot fewer questions and items that we are documenting on, the HOPE tool is intended to collect a lot of patient-level data in real time. So the HIS is really in retrospect. We document what happened in the past. When you document on the HOPE tool, you're going to be doing it and in real time at the different time points that I mentioned for you already. And then during the 2 HOPE update visits, those HUVs that will take place at the specified times, you're documenting, again, what's happening with that patient at that moment in time. And trying to capture, you'll capture whatever information is applicable to that patient in that situation. So I know that is confusing, but the big picture here is that while again, the HIS tool collected some information just at a couple time points, the HOPE tool is going to be capturing a lot more information and at the patient level and at the time of, at the assessment and documenting that. Okay. And I will, I think, hand it over to Elise.
Thanks, Claudia. That was a great intro. I appreciate that. I'd like to just go over some of the HOPE instrument FAQs that we already have from CMS. So one of the questions that we have is, does the full HOPE tool need to be completed at each new hospice update visit time point? And Medicare has told us no, that there are only select items that are in that hospice update visit time point. So we won't be re-administering the whole HOPE tool. Next question, what if the patient is only on service for a short period of time, maybe 10 days? And the answer is up to 2 HOPE time points are required, that admission and that discharge, and a hospice update visit if it was completed. So what happens to the hospice set after 10/1? Hospices will no longer complete the hospice item set after 10/1/2025. After this date, we'll be using the HOPE tool. And it seems like the follow-up, the symptom follow-up visit, SFV, is an additional time point. And it's really not. The symptom follow-up visit is considered a follow-up to the admission and the HOPE update visit time points, only if the patient has a symptom, like Claudia mentioned, that is noted as a 2 moderate or a 3 severe. So any symptom follow-up visit data would be submitted along with those time points if applicable within that 2-day time frame. Why are there no social work or chaplain data elements since these were tested? And Medicare tells us that during the national testing of HOPE, both social work visits and chaplains reported more challenge when trying to use the standardized tools and data elements. So for this version of HOPE, those items were removed. So some data elements outperformed others, and the results of the beta test did provide us a firm basis for the initial implementation version of HOPE, which we are starting next year. Can LPNs complete the hospice update visit? Right now, the severity, it must be completed by an RN. The severity follow-up visit, though, may be completed by an RN or an LPN LVN. And when will the public start to see the quality reporting data that's collected from the HOPE? Public reporting will start no sooner than fiscal year 2028. There's a lot of training already available on our CMS website, and the HOPE guidance manual is already available at the link provided. You can download the instrument and in all its iterations, the admission, the update visit, and the discharge on the website link that's provided. And you can submit questions to CMS via the hospice quality questions at cms.hhs.gov email address.
Thanks so much, Claudia and Elise. We did get one question. I'm not sure if we know the answer to this yet, but how does the HOPE data collection work for those patients who die within hours of being admitted to hospice? Do we know?
I would expect that to fall under that Q&A of that spoke to at least having the admission and discharge. If anything that's under 10 days would have to have an admission, and the discharge assessment would be my best response, I think, at this time. Elise, do you agree?
Yeah, I agree. That's what we have right now.
Yeah, and I can tell you, I mean, having been in home health for a long time, we always, when the OASIS came out there, and things continue to change and evolve, and it could be that somewhere down the road, as CMS sees that that's too cumbersome, or that it's not making sense to do both assessments in a short time period, because hospice is so very different in many ways than home health. I'm hoping that maybe they will help us with some additional guidance somewhere down the road, but that's just me being hopeful. That's not it's not them saying that right now. These are what we know, and I will definitely put a plug in for that CMS training that's on there, because they've done a really good job, I think, of working through what the HOPE tool is, how they got to this point with it. I mean, how it was tested, why they chose the questions that they did. They give you some practice activities in that as well. That's the one at the very top. What each data collection time point is, et cetera. And again, in each section for this again, training, and it is in the format of a real training. That's why it's in that Rainmaker Solutions format. But they give you some practice activities as they go, and then kind of what to expect. And there are, of course, lots of additional resources or people who can help or answer a lot of questions out there as you begin to make sure that you're trained, or that your staff are trained in preparation for this. But it's a huge change for hospice.
Yeah. So would that be your main advice, is to just start getting folks trained and familiar with the new, I forgot the word, I was going to say assessment, but it's
the instrument.
Yeah.
Yeah. No, I completely agree. I mean, you know, people tend to in these industries wait until the last minute, or wait until we're sure it's going to come out on a certain date or something like that. But this has been a tool that's been in the making for a long time. So I really can't see them, and I hope maybe I'm wrong, but I can't see them backing off on this start date, especially with all this, you know, very prepared guidance that's out there now. So absolutely, the earlier you prepare, and you have to keep in mind that adult learners, it takes multiple ways of hearing things and multiple times, a lot of times, to get the feel for it. So it's all out there now. So take it and use it, and move forward with it, and reach out to us, or, you know, I work for a software company. I feel like I do sometimes. I work for a consulting company who, of course, has resources, but there are lots of us in the industry and consulting and otherwise who can help you with these types of preparations as well.
Great. Well, thanks so much, ladies. That was really helpful, and hopefully we'll get folks started thinking about this and preparing for the change. And now I'm going to just move on to what's new from AHC. And if you are interested in issues of hospice, I wanted to let you know that if you're an AHC member, you can get a discount for earning your, for preparing for your HCS-H credential in hospice coding. AHC members receive a 20% discount on our study guide, and there's a link to that in the Decision Health store if you are interested in earning your HCS-H credential and would like to prepare. You also get an AHC membership discount on the Home Health Coding Manual, which is a great resource for both the HCS-D and HCS-H exams. And I also wanted to let you know what's new with the association. It is AHC member survey time. So if you are an AHC member, we want to know how we can better serve you. And the 2024 AHC member survey is live. Your feedback is important to help us better gauge your needs and to discover what you find most valuable about your AHC membership. So please take the survey by just November 15th. There's a link in your handouts that will get you right to the survey. And please take that survey to help us learn how to make AHC everything you need us to be. We hope you enjoyed this episode of AHC Talk. Thanks again to Claudia and Elise for all the great information. And thanks to all of you for tuning in today for this call. We hope you'll join us again for our November call when we will be talking about value-based purchasing. And in the meantime, if you'd like to re-listen to this episode or to a previous one on the go, you can find AHC Talk in your favorite podcast app. If you have any suggestions for future guests, topics, or ideas about the format of the show, please send me an email at jan.milliman@decisionhealth.com. Thanks so much for listening, and we'll see you all next month. Take care.